Hello, I'm Dr. Santosh. I'm consultant nephrologist. I'm presently working in Kamini Hospital, LB Nagar. I have completed my DM from Osmania. I would like to talk to you about what is the kidneys function basically. Kidneys, each person has two kidneys. Most of the times, congenitally, if there is no abnormality, one kidney will, two kidneys will be present. With two kidneys, patients will have very good life. So what are the functions of kidneys? Functions of kidneys, one thing is, what we know is they'll act as filters for the blood. They'll whatever blood is there, impurities which are accumulating in the blood, they'll remove that impurities and excrete it in the urine. It's a consistently present function which is there in all the kidneys. And as the function of the kidney starts coming down, the impurities which are present in the which are supposed to go into the urine start building up in the blood. Apart from purification of blood, there are multiple other functions of kidneys. One thing is they also maintain your electrolytes. Electrolytes are sodium, potassium, your calcium, magnesium, phosphorus, the electrolytes. So the salts which are present in your body or in your blood or in your whole body system, which are levels are present, they are usually maintained by kidneys itself. Third is maintenance of water. Whatever amount of water you are taking, the same amount of water which is required for the body will be kept inside the body. Others, the extra amount which is there will be removed off. So if you take less amount of water and you still feel like you're dehydrated, your kidneys will try to preserve the water and try to retain it, so that you don't get more and more dehydrated up to a certain limit. If you don't have much amount of water, then you will definitely get dehydrated, depending on how much extent of losses are occurring. They also maintain your blood levels, that is hemoglobin levels are also maintained by your kidneys. They produce a hormone called as erythropoietin, which tends to naturalize or it tends to maintain the level of hemoglobin in the body. So as these functions start coming down, you will start the problems of in the kidney failure start appearing. They also retain the amount of salt which is there in the body. They don't just regulate the level, they also maintain the amount which is there in the body also. At the same time, they're also responsible for production of vitamin D and regulation of your bone health. If your kidneys are affected, then definitely your vitamin D levels will start falling down. At the same time, bone level will also start deteriorating. So when do we call kidney failure? The common topic will be always when is that kidney failure is called. Kidney failure is essentially called whenever you have the filtering capacity in the kidney starts coming down to less than 60 ml, or you have some abnormalities in the kidneys itself, either by ultrasound wise, or let's say you get an completed examination done, you find some amount of proteinuria, that is protein in the urine is going on, or you have some amount of blood in the urine. At the same time, you find out there are some other abnormalities. Let's say pathologically somebody had their biopsy, that's a tissue diagnosis which has been done, and you find that kidneys have some amount of damages there. Then also they fall into chronic kidney disease. So how do we measure kidneys function? Kidneys function is usually measured by a test called as creatinine and blood urea, which are usually present in the blood. Once we start measuring them, based on the amount of level which is there in the blood, we can identify what is the level, what is the percentage functioning of your kidneys. If kidneys are not functioning properly, as I said, these two impurities start increasing in the blood relative to the degree of function loss of both the kidneys. So as the kidneys start failing, we start developing a lot of symptoms. So below 60 ml of GFR, most of the times patients will be asymptomatic. They might be prone to the other abnormalities. They can have some amount of dehydration. And the problem with the kidney disease is, chronic kidney disease, or as the kidney function starts coming down, is the ability to concentrate your urine starts coming down, or ability to dilute your urine. So whatever amount of water you're taking will stay inside, and you will pass urine at the same level. That is the reason commonly patients start complaining that they have polyuria, that is number of frequency of urination has increased, or they'll have nocturia. Urine production in the night time has increased. That is because the ability of a kidney to concentrate the urine is lost. So when that concentration capacity is lost, they are also more prone for electrolytemia. That is, amount of sodium might come down, potassium might come down, or reverse it might increase as well. At the same time, they are also more prone for dehydration during summers. If they start taking more amount of water, they might get overhydrated and start developing more amount of excess water in the body. So So as the kidney starts deteriorating, you start developing some symptoms. Apart from the electrolyte abnormalities which I told, you can have hypertension which can happen. Hypertension is increased blood pressure can be present, or you can also have swelling of feet. If patients had some amount of protein loss which was there, the edema would have been the presenting feature in these individuals. And commonest causes of chronic kidney disease. Commonest causes are in India. India is already we are becoming known in the world as the capital of diabetes, because the number of incidence of diabetes has increased exponentially, and that is the commonest cause for chronic kidney disease. Hypertension is one of the cause. You can have some congenital abnormalities wherein the kidney itself is it is not completely formed, or it might be malformed. And sometimes you can also have some connective tissue disorders. As the connective tissue disorders happen, your kidneys will start getting will get affected. You can have some drug intake which could be because of painkillers or some other medications which your body is not able to tolerate, and then kidney might get affected because of that. Or some of the antihypertensives which are not suitable for you, they can also cause your kidney to get damaged. Apart from that, some antibiotics are present wherein kidney might get affected. And at the same time, you can have post-renal, that is after below the kidneys. Let's say the pipes which are present draining into the urinary bladder, or below the bladder, the pipe which is there to drain to pass the urine. You can have some block in any of these tracts, leading to problem in the upper kidneys itself. So as the kidneys start failing, these are the multiple causes. Commonest is usually either undiagnosed hypertension which is there, and commonest in India is diabetes. Precautions a person in chronic kidney disease should take. First thing is you should maintain your pressures. Blood pressure should be under control. Your hypertension, that is blood pressure, apart from blood pressure, your sugar should be under control, and the medications which are used should be properly monitored. You should show it to a general physician or to a nephrologist to see whether it is properly responding to you or not. Second thing is you need to have some of the dietary precautions which you are supposed to take. Whenever kidney problem occurs, or when your kidney function starts deteriorating, you have to restrict your protein intake. Most of the times in our Indian diet, protein intake is a bit less. Western diet has very high protein intake. Recommended daily allowance for us would be almost 1 gram per kg per day. But in a person who has CKD, chronic kidney disease, for them the amount of protein restriction which has to occur is 0.8 to 1. That is less than the normal requirements. Because as the amount of protein intake is increasing, your kidney function starts deteriorating at a rapid rate. Apart from that, the type of tablets which you are taking, some of the tablets are present which usually a person with a kidney problem should not be taking, or they should be under monitoring continuously. With this, you have to also remember that you should restrict your salt intake. Once you start restricting your salt intake, your blood pressure starts coming under control. At the same time, your swelling of feet which is there, that will also start coming under control. You should also restrict low potassium, that is potassium rich diet has to be restricted. Any fruit juices are present, coconut water, or let's say some high potassium rich fruits are present, let's say bananas or citrus based fruits, those should be avoided. The preferred, if you want to take any particular fruits, low potassium fruits are usually advised. That being said, one is apple, pineapple, another is guava and papaya. Pears can also be taken. These fall under low potassium diet. With this, restriction of fluid intake should be present, because you are at a higher state. In a person who has chronic kidney disease, they are at a higher state of more prone for dehydration. You need to take correct amount of water depending on whether you have edema or not. In summers, at least half a liter can be given excess. So what are the modalities of treatment in a person who has developed chronic kidney disease to a very severe extent? That is, once the GFR, I keep on telling about glomerular filtration rate, that is as the kidneys start functioning at GFR less than 60 is usually called CKD. Once it reaches to a stage of less than 50, you fall into a stage 5D, or you're almost into requiring a requirement of dialysis will be present. So in these scenarios, what happens is you need to be vaccinated for few of the vaccines. HPV vaccine has to be taken up, and pneumococcal vaccines have to be taken up. If you're not previously immunized for chickenpox, or you didn't have any chickenpox in the childhood, it's better to get vaccinated for that. Second thing is the other modalities which are present are you need to see that you are at least willing for dialysis. If a person is not willing for dialysis, the other thing which is present is you can manage conservatively for only a short duration of time before you land up in dialysis. If it is less than 5 ml of GFR, that is less than 5% of functioning kidney is there, then the dialysis stage is imminent, you need to start getting dialyzed as soon as possible. And depending on your symptoms, you have to start up dialysis also. Preparation of dialysis, what you require is to get a fistula done. Fistula is usually a small surgery which is done in your non-dominant hand, either left hand for a right-handed individual or a right hand in a left-handed individual. Once you get a fistula, the maturation usually takes 6 weeks, and then depending on the maturation, you can start dialysis. Dialysis is nothing but a therapy wherein you are cleaning the blood of all the impurities which are accumulating because of the kidneys' inability to function properly. So the type of modalities which are present in dialysis are, you can have, one is hemodialysis, other is called peritoneal dialysis. A person who is independent and he is able to do his own work, preferably it's better to go for CAPD, chronic ambulatory peritoneal dialysis. If a person he is not fit enough to go for CAPD, it's always preferable to go for hemodialysis. The only disadvantage is you need to go to the hospital repeatedly to get your blood cleaned. Apart from dialysis, the best option which is there for a person who has gone to a stage of requirement of dialysis is to go for transplant. Transplant is always the best scenario wherein the person will become almost normal. So the type of transplants which are present are live-related transplants, unrelated transplant is there, and deceased donor transplant is there. So live-related transplant, what you have is based on our legal system, either parents can give, siblings, brothers and sisters, or spouse, either husband or wife can give. That is, you can directly give it. If it is unrelated, unrelated could be apart from the said relations, you can have other relations who can give. Let's say it could be your cousin brothers or cousin sisters, or grandparents can be given. They can also they can give donate a kidney to the recipient, to the patient who is on dialysis. So apart from this, if a person doesn't have any other donors, the third option would be to go for deceased donor transplantation. In deceased donor transplantation, once a person, an individual who had an accident or wherein brain has got damaged to such an extent that it's not going to recover, that stage is called brain death. So once brain death has been declared, the organs keep on functioning till such an extent till organs start failing. You can take up those organs and go give those organs to required individuals. So kidneys can be taken up. Each person has, they have 2 kidneys, so 2 kidneys can be given to requiring patients. So it doesn't mean that you have to wait till a stage wherein you require dialysis and go ahead for transplantation. There is something called as preemptive transplantation. There is wherein you can know, depending on the type of fall in your kidneys function, you can immediately identify at what level you might land up in dialysis and plan a transplantation accordingly. It's called preemptive transplantation. Regarding transplantation, that you need to be prepared for it. That is, before transplantation, as I said, if it's a live-related donor, you need to evaluate for the donor whether the donor is fit enough to go for surgery, or whether the kidneys are functioning properly, or are they at higher risk for any particular surgery which is being done. So based on this, and there will be some other surgical aspects like single kidney is present, or if 2 kidneys are present, which one is more preferable. Those tests have to be done. Then we can take up for considering for transplantation. The basic thing which is required is, first of all, a patient should not be a donor should not be a diabetic, and second, they should have same blood group as that of recipient, or at least a matched blood group. So O positive individual, a donor can give to anyone else. AB positive recipient can take from any other individual. So apart from this, you can also have AB incompatibility, but it's always preferable to go for AB compatibility, ABO compatible group. That is same blood group type of transplantation is always preferable. So with this, when we do it, what we tend to do is we have to go for some of the medications which are supposed to tune your body, or at least adapt your body in such a way that it does not reject an outside kidney. So apart from blood group, you also have some other groups called as HLA groups. HLA matching has to be done, and there is one more thing called as cross matching. If these 2 are positive, then only you can go for transplantation in a live related scenario. Or in a deceased donor, only cross matching is negative, then also you can go ahead. For immunosuppression, you require some medications to prevent your body from rejecting the kidney. So depending on the type of individual, we have to go ahead. Let's say a person is already a diabetic, the medicines which are supposed to be used will be different. If they are at a younger individual, if they are younger or at a older age, the type of medication which we give will be a bit different. Regarding immunosuppressive therapy is a type of medications which you give to decrease your immunity from rejecting the kidney. This immunosuppressive therapy is usually generalized. It's not specific to the kidney itself. So the person who undergoes transplantation will be at a higher risk of infections, at least initial period. That is at least 3 months is a crucial period. Up to 1 year, they are more at risk. So we need to take some precautions when you are taking it. First thing is immunosuppressive medications are life saving. They have to be continued lifelong, and the only problem is that they are a bit costlier. And depending on the type of, as I said, HLA matching. If the number of, if it's a very good match kidney, then the amount of medication which you give will be at a lesser dosage. At the same time, the cost will also come down. But they have to be continued lifelong. You cannot stop it. At least one day, if you think that you have not stopped it, you have stopped it, then the problem is your body might start rejecting the kidney at a subclinical level. You will not start throwing all the symptoms early itself, but gradually it starts through. So the moment your medications are, you tend to know that your medications are over, it's better to stockpile or at least keep a stock so that you don't miss out your medications. That is one. At the same time, immunosuppression, you have some, as I said, you are at a high risk for infections, so you need to take some precautions. That is, when you are taking food properly, boiled and cooked food should be taken. Freshly prepared food is always preferable, and instead of eating out, it's always better. You can eat out, but preferably it should be cooked, and at least boiled food should be present. And even if you're taking non-vegetarian, the diet which is there after transplantation is almost a normal diet. You don't have much of restriction with your diet, water intake or salt intake, because the normal kidney is going to function, will regulate all those things in your body. And you are at high risk for infections. The infections which are there, usually we tend to give medications to see that you don't develop infections. So within the first 1 year, you need to be at a higher, you need to take those precautions initially itself. At the same time, if some of the family members are present who have, let's say they have some sort of illness, either they are coughing or they have cold, it's better to stay away from them. Or if they have exanthematous rash, that is, they have a fever with rash, it's always preferable to maintain a distance till they, the disease in them, or at least the illness starts coming.